We are going to get started in about 1 minute. Okay, good afternoon. Thank you all for joining us. Region 10 Education Service Center and Partners Resource Network are happy to welcome you today to our family webinar for the month of December. Today's topic is public safety for students with disabilities. We have AD Paul with us from LifePath Systems, and at this time, I am going to turn things over to him.
Thank you very much. I'm honored to be here speaking about this subject matter. I think it's one of those, I'm a parent, and it's one of those issues that we've got so much stuff going on in our lives with our kids, or if we're guardians, and as they go into different stages of life, and one of the things that keeps us up at night sometimes is their safety. And so I don't enjoy the subject matter, but I think it's so important that we discuss these issues and find out, um, what different jurisdictions are doing to keep our kids safe, and collaborating with the district and the mental health authority like I work for now. So I'm excited to present to y'all today. I want to leave a good amount of time at the end for questions, and it could be any question. It doesn't really necessarily have to be the subject matter. So if it's something you've always wanted to ask law enforcement and just never got the chance, man, write that question down and we'll talk about it. So next slide, please. So this comes up. I get this question sometimes, what's going on out there in the world of law enforcement and IDD, or intellectual developmental disabilities. And so I would say probably in the last decade and a half, the subject matter has just been real important to law enforcement around the state of Texas. And so much so that it's been incorporated into mandatory training at the academy, and then ongoing training after officers get released and licensed to be a peace officer in Texas. Next slide, please. So the program that gets the most attention, and it incorporates some of our population, or really all of our populations of special needs, is crisis intervention teams, CIT programs. So there's a lot of stuff going on in those trainings, but I can guarantee you that most agencies spend a lot of time interacting with people with mental health challenges, also IDD challenges, so that officers are familiar with the language that we all use as providers or as advocates or families. And so it's a growing area of training and programming. So if you ever have interaction with the police department, and we'll talk about that more here in just a second, CIT is sort of that area that's everyone recognizes it as a training program, but the T actually stands for teams, TEAMS. So the concept is, you can do all the training you want to do, but if you don't have those kind of relationships with the community in these areas, then in some cases you're missing the mark, just because it's so important to kind of know each other and work together on these especially particular cases where a young man or young lady is experiencing some crisis, and law enforcement may, either in a school setting, SRO, or outside of the school, may have contact with that individual. It's just so important to make those peace officers part of that team. Okay, next slide. So these are just some of the programs. We're not going to spend a lot of time on these because I think a lot of you are also familiar with these classes and these programs. Take Me Home is, it's been around now for probably 20 years. And most agencies have some form of it where nonverbal individuals, whether they're adolescents or elderly, if they've lost the or never had the communicate, they were never verbal or lost speech. It's a program to where officers can, if they locate them out on the streets or the public finds them, that can we can reunite them with their family members without having to transport them anywhere. We can basically just take the pictures that are on our Take Me Home system and match them with the person that we have, and then get a hold of their emergency contact folks to get to our location and pick them up. Or it works in reverse. If a child goes missing from a bus or from a campus or from a home, we can send all that information, to Take Me Home information, out to all of our first responders, fire included, and we can kind of know maybe their triggers if that's shared with us, things that would bring them comfort and sort of help the people looking for the loved one to know some of the warnings that might exist. 911 flagging is kind of the same thing. It's just not if a jurisdiction where you're at doesn't have a Take Me Home program, and it's called, I think Allen calls it something different. I just can't recall what they call it. But if they don't have that sort of programming, 911 flagging has been around since there were computer aided dispatch or CAD systems. And so basically, you can call into your jurisdiction and let them know, hey, I have a special needs son or daughter or mom living at the address, and here's some of the information that's real important for first responders, whether it's police or fire. And then that can be added to the 911 system. So if first responders are going to that address, all that information that you're willing to share or needs to be shared, those first responders will know that before they get on the scene. So that's been around for a long time, and we've always had that capability. Home visits, a lot of jurisdictions will send an officer to a home, um, or really meet parents or guardians anywhere. If there's any doubt that this child or person may have some sort of heightened fight or flight response to first responders, we always recommend building those relationships. And home visits is just basically a simple way of introducing the uniform, the badge, the police car, the fire truck. And most jurisdictions can, we'll talk about it more, but we'll do that through our community services department or officers. School resource officers now have been around for maybe 30 years in some capacity. They're a great resource. They do get more training than the average police officer on our kids. And most SROs, they go to the SPED classroom and they love to go down there, and or have lunch at lunchtime and those sort of things. So that's really one of those programs that's really blossomed with our kids. And then positive police contacts, I think that's the next slide. It's a video. I don't know if we have time to watch it, but it's a real quick news clip on this class and sort of some of the concerns. If you, Sarah, if you want to pull that up, we can watch it. I just can't remember how long it is. I think it's just a real quick
Making adults with autism safer during a traffic stop was the goal of a Plano Police Department training session this morning, and we were there to see how it works.
A traffic stop can make anyone uncomfortable. Plano Police Sergeant A.D. Paul.
I still get nervous if the popo gets behind me.
But for a person with autism, according to
Dave, are you
Sergeant
still
Paul,
living on land?
the sirens, flashing lights, and verbal commands can spark sensory overload.
Then the police officer made me pull over, and then he warned me about the volume on the radio in the car.
The course is meant to familiarize students like Jeffrey Scott Douglas with the experience of being pulled over.
Okay, I'm going to get you out of here in just a second. Just stay in your car.
The rising rates of autism made today's course, which included time in the
Do you
classroom,
have any questions?
No, sir.
all the more important, and not just for the students.
A lot more comfortable. I think that all of us are a little intimidated when we're pulled over by the police, and it's actually helped me some too. So I think it helped him a lot when he starts driving.
While people with autism can struggle with social cues and communication skills, among other difficulties, Sergeant Paul explains that they can be a talented group.
The higher functioning folks on the autism spectrum are brilliant. A lot of them are going to go on to university. They're going to hold very technical jobs and training.
The CDC's latest numbers show about 1 in 59 children has been identified with autism. The rise could be due, at least in part, to more correct diagnoses. One more thing, Jeffrey, good luck. Once you start flying solo behind the wheel, you'll be great.
That class is it's a really a joy to teach. I still help Frisco and Plano, and McKinney teaches the class, and several jurisdictions in our area are teaching this class. Uh, when we teach one at Plano, you're always welcome to come to Plano. You don't have to live in the city limits to attend. So Texas has really come a long way too in the area of safety for our guys and gals. Um, Next slide. A couple of changes that have occurred. This if you go to Texas DPS Disabilities, you'll see some of this, and it sort of explains it. And I just went the other day, so they do a good job of trying to explain how you access it, and the forms that you need are right there and everything. But this is a big change. This is the Texas driver's license, and you can see at the bottom in the black background, communications deficit impediment, I'm sorry. And so it used to be officers had to turn the driver's license over on the back to see the different codes for different things that tell officers, about a particular driver. I think I still have A on the back of my driver's license where it says that I should be, driving with glasses and that sort of thing. So but now it's right there on the front. It kind of tells us right off the bat that someone may have, some communication issues. And so that's really a big help. Next slide. Oop. So the registration is also now available. And so both of those forms you can access them on the DPS website. So when an officer goes to pull over a vehicle, typically we call out the license plate, 123 AB Texas, 123 ABC, and we're stopping them for a traffic violation or something like that. The computer almost automatically sends us the registration information, expiration of the registration, insurance information, driver or owner information. And now we can add that same communication impediment to the registration. So an officer, even before he walks up to the car, now can know that there's something with the driver that may be delayed. He may not typically understand exactly what it is you're saying in these technical terms. So I think it's a big improvement here in the state. Real quickly, I think a lot of parents, a lot of guardians, and a lot of folks know about safety kits. There's a lot of them out there. Different nonprofits have them. They may include, posters, stickers, stuff that younger children can wear in their clothing to kind of help identify who they are and where they belong and that sort of thing. Tracking programs and apps. Again, there's a lot of them out there today. Most of them cost. Some of them have a monthly ongoing charge, and then some of them are priced out differently. So you have to kind of do your own research. Signs and stickers on cars and houses. A lot of times I leave that up, or I get that question a lot about the different things that are available out there today, identifying somebody on the spectrum or special needs. And really, your sons or daughters or your family members or people that you care for more than anybody else. And you sort of know, is it something that you're comfortable with letting the public know that you have someone who might be more severe? So I kind of leave that up to the folks that know their loved ones the best. Identification cards, you can always, there's more out there now than ever. Some of them are pretty cool cards that kind of give a real quick overview of the spectrum and kind of talks about some of the things that you might experience. And you can absolutely present those to police officers if you get pulled over, or if you're stopped and they ask you for ID or a driver's license. They're talking about those state issued IDs, but you can always offer them a personal card that you've had made that you keep, or with your loved one. Cell phones and iPads and those sort of devices, um, they're, for one thing, you can track those things now. So if your loved one has one of those devices, it's built into most of them. You can see exactly where that cell phone or where that device is. That's one cool thing about them. The other thing is that a lot of them are used for communication. My son used Proloquo. I pronounce it wrong every time. It's been a while since he's kind of got away from that, and we just basically do verbal. But those are great devices. Law enforcement's been trained on sort of some folks, and then not necessarily somebody on the spectrum, but some folks will use the aid of devices to communicate, and that's a common piece of our training now. Alarms, elopement's always sort of been an issue with some of our kids. Um, and whether or not, the low cost alarms are pretty good today. So you can put one on the door frame, you can put them as a door stop, and if the door is open, it's going to send off an audible alarm so that caretakers or parents at 2 a.m. or whatever, hey, that I know that door is opened. Um, a lot of our homes in the Metroplex have alarm systems, and you can set all the windows and doors to alarm if they're opened or ajar. So those are great devices. You just got to be careful with whether um, what's applicable in your jurisdiction. Exterior alarms, if the alarm sounds outside of your house, so your residents or your neighbors can hear the alarm and what levels. It gets a little complicated, but it's pretty straightforward with alarms. All right, next slide. This is a quick evaluation. LifePath Systems, they're such a great place to work. They let me do these presentations, and so they like to know how our folks are doing out there. So if you get a chance to scan that and do a quick evaluation on my presentation, although we're not finished yet, I just wanted to leave enough time for some questions that y'all might have, or something that I said that was just confusing, or any of those programs.
Hey, if you do have a question, please feel free to put that into the chat or into the Q&A box. And then, Jim, I know you work with so many families. I'm sure that you encounter questions as well. So do you have anything that you would like to ask?
Yes. One of the questions I get quite a bit is, can you go a little bit deeper and detail about this SRO officers and some of our friends that that exhibit behaviors and that are escalated at the time, and the how an SRO officer has a different responsibility than like a special ed person who does with that. Does that question make sense?
Yeah, I think so. So even though school resource officers get specialized training in their particular districts, and they get some education code that a typical police officer doesn't get, um, for the most part, they're not part of a missions retention and dismissal or an ARD. They're typically not part of the intervention plans for behaviors. And so I can speak to Plano and Frisco because that's the two districts that I was familiar with. I was an SRO sergeant for a few years, and I retired in 2019. And I think this is pretty much the policy and practice. If we get called to a classroom and we're requested to use restraint, right now, most of the training and the policies go towards not restraining one of our students unless it's an emergency. In other words, if they're doing something that they can be a serious danger to themselves or to another staff or another child or a staff member, the officers have been trained not to engage or not to restrain, basically. And there are several reasons for that. Number one, our experience has been that a lot of times that can actually escalate the situation if an officer goes in to restrain a child. Officers don't get CPI or SAMA or some of these less restrictive restraining techniques for several reasons. Number one, it's hard to teach an officer several different restraining techniques. And number two, we don't really want our officers engaged in those sort of behaviors on the campus. So we actually teach our officers to have those tough conversations with staff members sometimes, because sometimes our teachers don't really understand how problematic it can be for an officer to engage in sort of restraint. And so a lot of times we'll have those conversations way ahead of any incident where we, sort of say, hey, listen, we completely understand the classroom setting and sometimes the behaviors that you might experience. Hopefully, I think in Plano we called it there was sort of a response team on campus, and it was made up of coaches and assistant principals and maybe counselors, core team maybe. And so typically the SPED classroom has either a walkie-talkie or some way to communicate if they need help. And so the first thing that we would advise them to do is try to get your core team members to they're going to typically evacuate the classroom except for the student involved for the safety of the other kids. And they'll call the core team to try to verbally de-escalate the child and let them um, um, settle on their own. And then, worst case scenario, every district's a little different, depending on how the situation's evolving, whether or not they're going to take the student away from the classroom and someplace else on campus. I know I got into the weeds a little bit more than probably you're wanting, um, but
I,
it's a complicated situation and
yeah,
there's no easy answer sometimes.
definitely, definitely. And then one other situation that I come across in my CRCG settings where we're dealing with more mental health type of issues as opposed to at the school. Um, I've heard advice given like if a family is experiencing some kind of intermittent violence between family members because of their loved one and it has escalates from due to mental health escalations and there's that dynamic there, and so they're having to call the police to um, intervene. One of the pieces of advice I've heard, and I just want to hear your opinion if this is good advice or not good advice, is that they should be part of that Take Me Home program, so there's data there before they get there. But I've heard the advice of contact your dispatch and ask for the local officers to come meet the family in a situation where we're de-escalated, where we're not in a crisis situation. So the officers that are patrol that area have a working knowledge of the needs, the residents, so they have their information, within themselves, so they don't feel as escalated, not going into the unknown. Is that a good thing to do, or do you have any other pieces of advice to help with those ongoing situations where where it's just part of life?
No, absolutely. So CIT teams um, are now regular units. So Plano has like 5 officers and a sergeant and a social worker. McKinney has an LPC and a social worker and 2 officers and 1 sergeant. I think Allen has a full-time social worker. And so, and other agencies have part-time people. So you can always reach out to the CIT unit or
Okay.
the people that are specially trained. They probably know the location or the person if the officers have had earlier interventions or other contacts with them.
Mhm.
But it's always a good idea to sort of talk to those crisis officers about, your loved one or the person, and just let them either communicate with the beat officers or the detectives or whoever else in the agency that might have a need to know.
Okay.
I know that privacy is always a factor in some of this, and so what what they're willing to share. Police departments aren't guided by HIPAA, but we also have open records. So any information regarding someone's medical conditions,
Mm,
um, wellness, that's protected data. So we don't have to release that to the media. We don't have to release that to anyone really. And so, but yeah, I would recommend that. There's some other things, NAMI, the National Alliance on Mental Illness, they publish a 911 call sheet for families. If you ever have to call 911 to have the police respond to your home or apartment or whatever, it kind of gives you a checklist for their safety. Some of the things that you probably need to let the dispatcher know. In the world of dispatch, when you call 911, you're talking typically to a call taker, and she's or he's typing the information to the main channel person in that area, whatever station or whatever channel that call is going to go out on. And so, what I tell parents, um, whether it's IDD population or mental wellness, let the officers or the dispatcher know as much information that they need to keep your loved ones safe, and let them know as much as you can, as early as you can, about the person and any special needs that they have, or even mental illness, because all of our officers have gone through this training and they get ongoing training, so they can switch from a family violence mode or disturbance mode into that CIT mode quicker. It doesn't mean that they're not going to still protect themselves and other people, but it gives them some idea that the person may be highly agitated at the time that they get there, and they've been trained not to, scream out commands, and they're going to model, the how they want that person to react. So they're going to be softer, and they're going to give them space. And a lot of things that they're not going to do in a typical situation where someone is agitated and maybe threatening others.
okay, that's great information to know. The crisis intervention team, because they just have more experience and deeper training. It sounds like that to meet those escalated needs.
Yeah, and they're connected to, in most counties in the Metroplex, we have like life path systems, Denton County MHMR, Tarrant County MHMR, and I think it's Metro Care
Yeah.
in
Yes.
Dallas. They know all of the IDD crisis folks that work those areas. They know that some of the nonprofits that can help. So they've got a pretty good idea of how to get people help without, arrest or without transporting them to some sort of mental health facility.
All right. Well, thank you for answering the questions that I get quite a bit. I really appreciate that.
Yes, sir.
Thank you so much. I don't see any other questions in the chat or the Q&A at this time. I'm going to go ahead and move to the last slide, which has all of the AD's contact information on there. I know that he said that he is more than willing to talk to anyone that might have additional questions that they didn't want to share during today's webinar.
Anyway, launch a poll.
Yep, and at this time, we'll go ahead and launch our poll. Thanks, Ashton. Thank you so much to everyone for being here today. And thank you, AD, for being here and sharing this really valuable information with our families. We appreciate your time.
My pleasure. Thank you all.